We are live.
All right. Can we come to order, please?
Director Asner?
Present.
Director Faulkner?
I know it's
Here.
Director Goodman? Here. Director Ide? Here. Director Potroff? Vice President Brown?
Here.
And President Cuneo?
here. Can we all stand for the Pledge of Allegiance, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everybody, for coming tonight. For agenda. There we go. This is Board Appreciation Night.
Get the roll call.
We did.
Oh, we just did? Okay, great. All right. So this is Board Appreciation Week, so Henry's going to be passing out some things for you. Well, this year's Missouri's annual School Board Recognition Week will be held the week of February 15th. I'd like to take the opportunity at tonight's meeting to celebrate SSD's Board of Education. Our board members volunteer countless hours serving SSD's children, families, staff members, and the community. Their work and their commitment are greatly appreciated and are critical to the success of our district. In all of their duties and the decision-making efforts, students remain the key focus of our board of members. They strive to make our schools a place where all children, regardless of age, ability, gender, ethnicity, or social economic status, can grow and learn. We are grateful to the members and the voice, and I hope that it's a successful future. Please join me in showing the appreciation in our SSD Board of Education for continuing leading us in the right direction. Give you guys a round of applause, and thank you. Does anybody want to say anything?
It's a pleasure to serve on this board.
It's an honor.
It's an honor.
Hearing the students is the best part.
Yeah, the cards are really sweet and very much appreciated.
Thank you.
All righty, thank you. Public comments.
Okay, we have one public comment this evening.
Welcome to the Special School District of St. Louis. Welcome to the Special School District of St. Louis County's Board of Education meeting. Up to 30 minutes of each Board of Education business meeting will be set aside to hear public comments. The Board of Education values your input and thanks you for your comment. The guidelines: each comment is limited to 3 minutes to address any item that is a legitimate part of the board, business of the board. No confidential or personnel-related topics are allowed. Comments will be read in the order in which they are received by email. The contents of the email and the sender's name and address have been submitted to the Secretary of the Board and will become part of the official public record of the meeting. My understanding, we have one public comment tonight.
Yes.
Amy, it's yours.
Okay. The public comment this evening is from Michelle Hill. To whom this may concern, I am expressing my disappointment on how you are handling the safety of the students, parents, and staff. I have reached out on more than one occasion to the board. I have 2 seniors attending, and it is a disgrace how you basically have kicked them out at the 11th hour. I am disappointed on how you have tossed them to the side because there isn't a hybrid or virtual option. So now the best year of their lives is fulfilled with frustration and tears.
You kicked my kids out of your school at such a critical time in their life. You have made them decide between their health and the health of their household because of how selfish you are in this pandemic. You're risking the lives of your staff as well. We have had death and exposure due to COVID, and for you to kick both of my kids out is punishing them. I thought the kids are to be everyone's priority and concern. It doesn't seem that they are the forefront of the thought process. This concerns me. There are some really great teachers and staff that are stuck with just going along with this, with no choice if they want to keep a job. This is horrible. My kids have wasted now almost 2 years of their time for nothing. They ask me why they don't care about them. We are right here in the last couple of months, and now we are being punished in more ways than one. Now we have to scramble to figure out how to graduate and possibly participate in other programs due to them being kicked out of South Tech High School. So not only are they having to worry about the pandemic and safety every day, they're told to put their parents and grandparents at risk to continue their education. What kind of choice is this? In the last few months of their senior year, you are being insensitive and are adding to their anxiety during this time. Why couldn't some exception be made? Why did I get radio silence and no response back to multiple calls? The lack of response to my emails allowed me to see how much you do not care about my children. This behavior is unacceptable. If my children were to get kicked out, if my children were to get infected or better yet, become asymptomatic with COVID-19 and brought it home to me, who has underlying health problems, and I was able to get it and have to miss work or go in the hospital or worse, are you going to be responsible for the financial hardship and loss of a parent in the home? Or what happens if they catch it and it is given to the grandmother who lives with them? Who is going to take care of my children then? Will SSD take care of my family when I am gone? I feel that board does not truly care about the senior students, especially, and have no care for life of the parents and definitely not the staff. The pandemic is real, and you should consider that the numbers are not going down significantly enough for your return to school. The hospitals are to capacity, and this is your indicators to return to school. Because of the way I have been treated and no response from you, I have gathered the information, and I am prepared to go to the local news station and other agencies to show your lack of concern for my children and others. My children and others are important too.
Thank you. All right. Someone like to make a motion for the approval of the agenda?
So moved. Second.
Second.
All in favor?
Aye.
All opposed? Motion carries. Student Services, Health Services Department update.
We have a report and update on our vaccine to the board. We will have Dr. Campbell. He is remotely. We will also have Alan Wheat and Erica Mitchell, who is our Director of Health Services. You can please come to the podium.
Good evening. President Cuneo, Vice President Brown, Board Directors, and Dr. Keenan. My name is Alan Wheat. I'm Executive Director of Student Support Services. With me tonight, I'm introducing Erica Mitchell. She is our Director of Health Services here at the district. We got her from Riverview Gardens, where she was doing wonderful work, and we're very grateful to have her supporting us. Also on the Zoom call is Dr. Campbell, who is our Medical Director, and runs the IFM Community Medicine Clinic, and will be providing some information for us tonight. So, Erica, thank you very much.
Thank you, Al. Good evening, President Cuneo, Vice President Brown, Board Directors, and Dr. Keenan. Again, my name is Erica Mitchell. I'm Director of Health Services, and I'm here this evening to present information about the phase response related to the COVID vaccine availability and PPE to staff. So again, I'm transitioning from Riverview Garden School District from a 6-year supervisory role, supervising school nurses in the school setting, with previous school health experience. I am a master's prepared registered nurse with concentration in adult gerontology, nurse practitioner. In addition to that, I have a bachelor's in science from Chamberlain. So this information is an update from Dr. Campbell.
So, Dr. Campbell, are you able to unmute?
Yeah, I think can you hear me?
Yes. So, could you give us an update on the new tiered structure for vaccine administration?
Yeah, I think you have some slides on that, and you guys are gonna present that in a little bit. I was gonna just jump down to the second point about vaccine availability and wish that I had some positive news. As you are seeing on the news, the vaccine is in short supply in Missouri in particular. And so far, the doses have been directed to the health departments and to the hospital systems. When we get into the tiered structure, we'll discuss that. We're currently in 1B1 and 1B2, which includes high-risk individuals, 65 and older, and with pre-existing conditions, and 1B1 is first responders. So we're not really even yet officially into the section that would immunize school health individuals. You see on the PowerPoint there the description of a point of dispensing or a pod. I've had discussions with St. Louis County Department of Health and offered that in the case of special school district or some of our shelter clients, that if we can access the vaccine, we would be willing to do what they call in public health terms a pod distribution, meaning coming on site and having a mass inoculation at one or more, perhaps the South High School and the North High School. However, it's all a matter of getting access to the vaccine, and so far we don't have any guarantee that that's going to happen. We, as an organization, have been approved by the state of Missouri as a vaccinator, but that doesn't guarantee that we get any vaccine. So I have encouraged, we worked with the district to first of all sort of create the priority list, because if you have 2,500 people who need it, you're probably not going to get 2,500 vaccines. So what happens if you get 1,000, or what happens if you get 500? And so Alan has worked on those prioritization numbers and lists. And if we're able, and we've also encouraged and circulated the information to everyone to get on any list they can. So if the health systems and the health departments have links that you can go on and register, you have to tell them, what your position is. And then when they get to that point, they will begin to call people. I've encouraged people to get on as many lists as possible, but if they once call you for an appointment, then you just make one appointment. You don't make multiple appointments. It would just be one. So it's kind of I've referred to it as any port in a storm approach that, we would love to be able to do this in an organized fashion. for the district as a whole, but everyone needs to try and get on lists and get access as soon as they can. Right now, we're going to definitely be into February. I think we're going to be in the end of February before a larger quantity of vaccine would become available, even to get down into the 1B2 or 1B3 rather, which is where the school is. But also whether or not any more vaccine would become available to other vaccinators, such as IFM, to be able to run a pod distribution.
Thank you.
So the slides before you are brief updates regarding SSD's approach to a phased response. I want to update you on the plans regarding the COVID-19 vaccine. SSD remains committed to ensuring that the vaccine will be available to all staff in all schools, programs, and partner districts that are interested. During phase 1A, medical and physical therapist staff have already received their first dose. Next slide, please. On January 15th, and are scheduled for their second dose through the coordinated efforts of a local hospital agency. By identifying interested 1A employees, nurses, and PT staff, and gathering their contact information. As of Monday, January 25th, Missouri announced plans to vaccinate millions of Americans beginning this upcoming Thursday, January 28th, as the state moves from 1A to 1B to include critical infrastructure workforce members, identified as educators and school staff employees. SSD will follow the tiered rollout of the vaccine and will coordinate with the licensed healthcare provider to begin administering staff members who have a close proximity to students with personal care needs. The SSD vaccination place, which details the various tiers, is available to reference on SSD Life. Phase 1B, Tier 2, will be activated Monday, February 1st, including anyone age 65 and older and any adults with certain underlying conditions. Any staff member who qualifies for the vaccine can receive the vaccine. Then their membership for the Tier 2 supersedes their membership for Tier 3. According to Governor Parsons' vaccination distribution team, there's about 2.5 million Americans, about 40% of the state's population needing a vaccine right now. The state says that the activation of Phase 1B, Tier 3, which includes teachers and other essential workers, is yet to be determined and is likely dependent on the state's vaccination supply. However, in preparation for the availability of COVID-19 vaccine, we're asking for information from SSD teachers and staff to speed up the notification and distribution process. For instructional staff, teachers, paras, itinerants, transportation, related services, food service, custodial facilities, and clerical staff and administration. Staff are encouraged to acquire vaccination through any licensed healthcare provider. As Dr. Campbell mentioned in his report, SSD is contracting for vaccination clinics. We don't yet have identified the need or identify the vaccine supplies. So we're encouraging people to sign up for the vaccination, as indicated before, with any public or private sector that supplies the vaccine, and to await the opportunity to get that first available vaccine. Currently, SSD is assessing each qualifying member in the Tier 3 category about interest in receiving the vaccine, identify the priority groups of employees based on their role with students. Staff supporting students with self-care needs, significant medical care, or students who require social emotional support will be considered a priority. In addition, we are working with IFM Community Medicine to schedule vaccine clinics, and we'll be exploring using our nurses to increase capacity to vaccinate staff. Additionally, the supply of vaccines is expected to significantly increase when the next two awaiting vaccines have cleared the emergency use approval process. And so, in those vaccination companies are Johnson & Johnson and AstraZeneca. Late Monday, more than 160,000 individuals have received an initial COVID vaccine dose, and more than 22,000 have now been fully vaccinated with the 2-dose series. Next slide, please. Next slide. On our next slide, this information has been provided to each staff member, PPE, personal protective equipment, for the protection of COVID-19, to include masks, face shields, gloves, alcohol-based hand sanitizer. Staff at greater risk have had access to KN95 masks, face shields, gloves, KN95 masks, gowns, head coverings, and shoe coverings. Recently, supply capabilities have improved that allow the district to acquire N95 respirators, and the N95 masks are a high standard for face coverings. Employees requesting N95 masks will be fitted as required by OSHA, Occupational Safety and Health Administration. With that said, having this vaccine available for school staff will provide an added layer of protection. However, we will continue to roll out our plan. We must remain vigilant in continuing to follow other necessary COVID-19 mitigation strategies, including wearing a properly fitting mask to cover nose and mouth, maintaining physical distance between people, and reinforcing proper hand hygiene. This concludes our presentation. Are there any questions?
And could I give one additional piece that is true since we produced this PowerPoint? We have since understood that our nurses and our 1A staff we're considering as under the OSHA regulation for fit testing. We've understood more completely now that other staff that we are making the masks available to in the interest of allowing them to feel safer, they will undergo a fit orientation and be provided information, but they will not be fit tested.
Meaning they'll be provided with N95 masks, whether or not the fit testing was passed.
Correct.
I have a question for Dr. Campbell. You made mention about the possibilities of delays or time that maybe we'll actually realistically look at having been able to get to the various tier levels of vaccination. Is it possible that due to the deep aspect of politics that our particular state seems to have embraced, that could have some effect on our abilities to be able to get ample quantities?
I don't have any information that would support or refute that. I'm not sure what's all going into the state distribution. It just, the reports have been that Missouri hasn't gotten quite what they were anticipating, but there hasn't been an explanation as to why.
In the signups, would that not necessarily give some indication as to the desire of many of the people in the state that want it? And I'm saying this because so many of our citizens of this state, may have a different viewpoint regarding this particular issue that we're facing. And I'm just wondering whether or not that has a way of entering into some of the decisions that may come about in reference to distribution.
I think, the initial effort in all states is to try and get as much vaccine so that anybody who wants the vaccine can have it. It still remains in most settings an individual choice of the individual as to whether they get it or not. There may be some settings where it's being made mandatory, but that's not the general rule. But I don't think that's impacting the flow of vaccine.
Okay.
Thank you.
I have another quick question, or rather maybe a comment, and you may already be doing this, but you mentioned that we may become a pod, SSD may become a pod. And if so, I hope that you, in preparation for that possibility, have a plan for how to communicate vaccine availability and scheduling for the staff at SSD, so that all that is in place. There's a plan and a way to do it, just in case we get the vaccine, so that the moment we get it can spring into action.
So, yeah, it's a good question, because that's why we've submitted a survey to our staff to say, are we interested in that, in the coordination, so that if Dr. Campbell does receive it, that we would be able to expedite some of the planning of scheduling, so people can come in and schedule times, because we don't want people waiting outside for too long period of time, but we are making sure that we can get that ready to go, so that when we do get it, we can move fairly quickly.
That seems to have been the biggest breakdown
Yep.
in getting the vaccine out. Is once the vaccine was delivered, there was a plan for distribution.
Right.
Yeah, and I could expand on that just slightly. We, in gathering that information, we have about 2,600 staff who have already identified their interest in the vaccine, and we have systems to be ready to go at a moment's notice. So we are also working with Dr. Campbell to utilize our own nurses who have already been vaccinated to increase IFM's capacity to vaccinate more. Plus, we're looking at systematizing the entry process so that when a person gets there, they're not fumbling with paperwork and insurance cards. They're presenting their driver's license and a signed document, and off they go.
Because they've already been registered ahead of time.
Yes.
I understand there's a 15-minute period afterwards whether you need to observe the person or move them into that station next.
Yep, and you need space for that because obviously you can have a lot of people waiting there.
And we'll be able to set up the pod station with plexiglass, so we can be able to set those up in our gyms.
Yeah. I'll say a gym is a great place to do that.
Yeah.
Thank you very much.
Thank
Thank
you.
you. Thank you.
Well,
All righty. Transportation.
We got the equity presentation. All right, this is a quick follow-up to our last presentation around the equity statement. The board wanted us to go back and kind of work on some work with it. So Dr. Bolton and Dr. Macklin are here to kind of walk us through some very short presentation around some of the equity statements that we want to be able to add into the equity plan that's in draft currently right now. The goal is to be able to get your feedback on these, so walk us through, circle it, we're going to do the dots, and also give you an opportunity to highlight any wording that you might think we should add into some of the overall agreed upon options. And the next thing what we're going to do is we're going to take this, put in more information into the draft that we have. We also heard from the board that we would like to see more indicators more data put into what does indicators look like in here. So when we bring this back to the board, which is scheduled in March, we'll be able to finalize those pieces of it so that we can look at improving or kind of moving towards that approval process for the board. So I'm going to turn it over to Dr. Bolton and Dr. Macklin. Welcome.
Good evening, President Cuneo, Vice President Brown, Board of Directors, and Dr. Keenan. My name is Molly Bolton. I am the Executive Director of Teaching, Learning, and Accountability. And this evening I have with me Dr. Macklin, who is the Director of Equity. As Dr. Keenan said, we have created a process for you to look at 3 options for the definition of equity, which Dr. Macklin will.
Thank you. Good evening, President Cuneo, Vice President Brown, Board of Directors, and Dr. Keenan. And so the purpose of this presentation is to present some options for the district statement of equity. Again, the purpose of this presentation tonight is to present some options for the district statement of equity. And so, of course, we have the potential mission, the vision, and the core values. And so when you talk about those 3 pieces here that align to the equity statement, one of the pieces that I would like to point out here is you look at the very bottom, that's the core values here. You see every student, regardless of learning ability or socioeconomic status, deserves the access to the services they need to succeed as relates to the values of equity. And so, option number one, a couple of key points about option number 1. Educational equity exists when there is intentional focus. So intentional, not by chance, doesn't happen by chance, but it is singled out and pointed out to ensure students have success. Also, when we focus on learning outcomes, we also talk about learning outcomes, which equates to student achievement. Also here, when you talk about access is important, and access can even be more important when you talk about equity, then allocation of resources, because a lot of times when you have the achievement gap is funded or driven by the lack of opportunity gap. And so that access is key when we talk about option number one. Also with option number one, there is a clear, also intended focus on outcomes. And so you're not continually spinning your wheels when you have that statement that is there. Option number two, when the district has an intentional focus to ensure each student excels. Option number three, educational equity is an intentional measure of achievement and opportunity, which is really the technical definition. And so on the next slide, you will see here that you have the emotional definition, which is a very option number one. In the middle, you have option number two, which is the district has an intentional focus to ensure each student excels. And then the last option, option three, which is the technical definition. And so you have dots. This is the process. You have dots, yellow dots, and those yellow dots will be the indicators that you will put there on each option. And so that will serve as your vote tonight for the option.
You also have at your table your own that you can put some edits or any circling of the words if you want to be able to do that too. You can still utilize the dots behind us on which ones you guys like, and then you can add in any additional verbiage or anything else that you guys would like us to consider.
Do we put it on here or put it on there?
We can put it up there if you want.
Oh, and there's a question from Vice President Brown.
Yes.
Dr. Bolton, Dr. Macklin, can you please define or expand our definition to include educational equity around what populations are included in our deliberate approach to equity, example, race, socioeconomic status, etc.? Director Faulkner, Vice President Brown, please let me know your selection. You can just message me. Can you hear me?
I have extras if you can't find your doc. Placed on your, do you have it, Director Goodman? I had placed it on your book. I think it's under, maybe underneath your phone.
Oh, here it is.
Yes.
Yes, you can give those to us.
Up here, or we'll give those?
We can take those and you can give them to me and then we'll take those.
Did I put the dot on the one with my changes?
Yes, then that's okay. Oh. Okay. And then, you want to just tell Ms. Brown that I captured her, those pieces of adding that into.
Oh, you did?
For raise, or should I not?
Okay, perfect.
Can I just ask maybe a contextualizing question here? Because we're spending a lot of time on these definitions. Is this coming out of a disagreement on what we should focus on, or a disagreement on how we should all define something that I think that we agree on?
Say that again?
So, in other words, I put my vote not because I'm super happy with the definition, but because this was my vote to move past process and into product.
Yeah.
I think we're spending a lot of time on the definition. I'm not sure, I think we all maybe I'm wrong, maybe I'm not hearing it, I think we all agree on the definition. And I'm just worried we're spending a lot of time on the wordsmithing of the definition as opposed to getting to the, what do we do with this? So that's my question, I guess, is it that we're trying to, is it that we don't agree on what we should be focusing on when it comes to equity, or is it that we are trying to agree on how to describe the same thing? I don't know.
I think the ironic part is the plan is really solid and moving forward, in
Yeah.
spite of the fact that we don't have the words on the
Yeah.
equity. So,
Well, I think that this is one of the pieces, unfortunately, that you hammer out and you flush out to be able to move to the rest of the plan, as Director Goodman says. And that's the framework and the rest of the pieces that incorporate and normalize it into the district. And so that's why the option tonight was given to provide some options so that we can settle on this piece and then move forward from theory to practice.
Is Billy Brown saying something right now? Oh,
We did capture that comment.
okay. Play in the video.
Yeah. All right,
So I
Thank-
think we've got all the options. We will take this back, and I think, Director Asner, I think that, your question is an appropriate one. I think we want to make sure that this is moving forward. And, Ms. Goodman's saying too, we've got a good solid product, we just needed to tweak some of these things so that they're more, so we'll bring this back to you guys in March, and to be able to finalize the equity plan and move it forward.
I agree with you. We've been playing with this concept for 7 years. Now, we've come farther in the last 3-4 months than we have
In 7 years?
in 7 years.
Yeah.
But after 7 years, I mean, that beats the gestation period for an elephant. We've really gone way too long on this. We need to get something done.
Yeah, I agree. And I think, and I don't want to speak for Dr. Macklin, but I don't think that the anxiousness around this is to keep it moving forward, so that really for me, it gives us the guiding direction of where we need to go, so that when we use this, we can look at every aspect within our district to make sure that we're applying what we're saying we're doing in every department, every function, every decision that we're making.
100%. I would say systemically and organizationally to guide any decisions that are being made. And so to make sure that is done thorough, and that's what this process is for. So this process tonight really covers that piece to close that loop and move to the next, and so we're excited about it.
Yeah, and I think Dr. Macklin's done a wonderful job of researching where we've all been as a district, but I think you're right. Now we're going to move into some action and to be able to move it forward. So I thank you.
I'm going to respond to Director Brown and say those are the changes I hand wrote on my version.
Okay.
Great.
Yeah.
Thank you.
Thank you.
Thank you. Thank you. Appreciate that.
Thank you.
Planning. All right, next time. All right.
Next is the transportation,
All right.
5-year plan document.
Yes, as we started last year, we are going to continue to update the board on all of our key plans going forward, so that you can see this prior to the budget when we look at what we're looking for budget requests. So, Mr. Mulder will be showing us what their 5-year plan for transportation will be.
Sure. Good evening, President Cuneo, Vice President Brown, Board Directors, Dr. Keenan, Kenny Mulder, Director of Transportation. And as Dr. Keenan said, I'm here to give the Transportation 5-year plan update. The transportation overview. Transportation services are available to all students attending SSD managed schools and programs, including separate public schools, career technical education schools, and vocational training programs. The department oversees 2 in-house locations, our central and south garages, and our North Garage, our contracted location, Student Transportation of America. And one point I didn't include on here is we also oversee transportation partnerships with Parkway, Melville, Kirkwood, as well as 2 alternative transportation companies, EMT and ZipCare, that we all oversee those as well. Our leadership team consists of myself. I have 2 transportation managers, Robin Ray, Kevin Knuckles. Robin is based out of our South Garage, and Kevin is based out of our Central Garage. My supervisory team, Lloyd Gibbons is our fleet maintenance manager. Denise Bain is our safety and training manager. Kelly Webb is our routing supervisor, and I have Art Silverman as our lead road supervisor. Staff snapshot, so we have 3 safety trainers or driver trainers, 5 technicians, 2 fuelers, 5 dispatchers, 137 drivers, 108 monitors, and 2 secretaries. Our routing snapshot is at South Garage. We have 59 routes, 56 routes at Central Garage, 124 routes at North Garage, 29 routes at Parkway, 16 routes at Melville, 6 routes at Kirkwood, and 76 cab or alternative transportation routes. Vehicle snapshot, and this is district-owned vehicles. It just doesn't include our contracted service vehicles. Type A lifts. Type A is the small vans. We have 13 of those. Again, a Type A or a van, we have 7, just a straight bus, we have 71 of those. Type C, which is the bigger buses with the tilt hoods, equipped with lifts, we have 95 of those, and just the straight bus, Type C, we have 18 of those. Our average fleet age is 5 years, and we have 8 service vehicles in our fleet. Fine. This is just an overview of our transportation cost. Our salaries, our total expenses is about $35 million, and our total revenue is about $8 million, expense net revenue of about $27 million in transportation. Some of the goals we have accomplished, one of them was to increase staff levels to meet the daily operational needs without jeopardizing student safety. We added 5 driver positions, 5 monitor positions, and 1 transportation manager positions. That goal was met in July 1st of 2020. Our next goal was to update our internet system to facilitate current and potentially acquired operating system. This goal was met this past summer. We increased our speed for our internet. Our next goal was to add GPS systems to all buses, and this is still currently in process. We're working through a company by the name of TransFinder, which is our routing software, so that it all communicates together, and the GPS company of Zonar. Another goal was to implement a parent app tracking system. That's, again, currently in process. We're working with TransFinder, which is a stop finder app for parents to utilize. We've also been working with a program developer for our ridership program, which includes pre-trip, post-trip. It's a ridership program. Also, it allows us to communicate with the teachers and case managers. Year 1, begin active property search for our Central Garage. We're currently in the process of that now. Filling all open positions to determine most effective advertising systems to attract new hires. We're currently working with HR on creating newspaper ads and our hiring process and things like that, so we're working through that. Create a sub-pool of FTE positions to increase options for route coverage above our 10% standby ratio for our labor contract. We'll discuss that hopefully in our negotiations this coming year. Train all pertinent staff to transportation data collection. It's kind of held up to COVID because that's kind of almost an impersonal face-to-face meeting that we would need to have for training. Add parent application utilizing GPS tracking system. The cost of that's about $265,000. Increase staff parking for South Garage employees. We are currently in the process of cleaning up an existing area, removing some vehicles and things that are in that area so that we can utilize that for parking space instead of just old vehicles. And then on average, purchase 25 bus, so $1.5 million. Year 1 continued. We're going to research the student tracking attendance system, currently being developed, which is about $178,000, and establish an electronic access for required transportation forms, that's included in the tracking and attendance program that we're working on with the developer on. Cost for all that is about $1.9 million. Year 2, obtain a fully staffed workforce, set individual transportation budget for SSD schools and partner schools, establish a committee to develop standards for student travel training. Again, we've kind of got that on hold because of the COVID, and hopefully we'll get through that by the end of the year, I'm hoping. And again, purchase 25 buses on an average about $1.5 million for a total cost of $1.5 million. Year 3, our goal is to update some of our outdated maintenance equipment, around $30,000. Begin the building of the new central garage, which is around $6 million. Review of our contracted service. Purchase 25 vehicles, about $1.5 million. Total cost of year 3 is about $7.5 million. Year 4, move into our new central garage facility. Review contracts for partnership agreements for efficiencies and economically. Review current training modules for compliance and update or revise or modify if needed, figuring about $5,000 for that. And again, purchase our average purchase of buses for the year, $1.5 million, so just over $1.5 million for the total cost. Year 5, currently our camera systems are passive, which means we can watch what's already happened. We want to upgrade our camera systems to live view so we can see what's going on the bus at all times if there's ever any concerns, and we're looking at about $300,000 for that. Install video surveillance for transportation buildings on all of our lots. Currently, we don't have any surveillance, so that's something we'd like to have. It's about a $10,000 cost, and again, purchasing our 25 bus on average for a total cost of about $1.8 million. Questions? Yes, ma'am.
You said the GPS was in progress?
Correct.
When are we hoping that will?
I'm hoping that we're going to find out the exact product we're going to go with this year and implement that next year.
Okay.
So we're in the works now. We've piloted some systems, and we're currently working with our routing software. What I want is something that communicates. Rather than having multiple systems, I want something that communicates with my routing software, with the parent app, with the student tracking, all of that. So that's what we're really trying to focus on now, and just making sure everything communicates well so that we're giving good information.
Go live next fall.
That's my hope, yes.
How many buses do we have in total?
We have 195 that we own.
Okay.
And contracted, we have another 150.
Bless you.
It's when I was trying to go through. We're changing buses at every 5 years?
We change our bigger buses every 10 years and our smaller vans every 7 years.
You purchase so many each year.
We purchase and trade, yeah. We trade in 25 buses and purchase 25 new.
And we keep them 7 years?
We keep our vans for 7 years and our larger buses for 10 years, yes.
We should have a larger fleet then, because I'm getting, if...
Well, on an average, I say we replace 25 a year. Not always do we replace it.
Okay.
We replace them within the category of the 7 and 10 years, wherever that falls, and generally it's anywhere from 15 to 25. But
I was trying to figure out, if our fleet is 5 years old.
gotcha.
No,
That's just an average age of 5 years, yeah. We have buses that go back all the way to 2000, I think 2012 is our oldest bus.
What's our insurance cost? I didn't see that.
I don't know what our insurance cost is, but that's something I can.
No, I mean, does that go into this budget?
That's a separate budget.
Okay.
It's outside of transportation.
Then the last thing I was wondering is the central building. That's a capital expense. Would that go under this budget thing?
It would go under probably our facilities budget, I would imagine.
Yeah, we move that under facilities, but
Yeah.
that's just kind of the idea.
Okay, I was just trying to figure out where the monies were. Okay, fine.
I need a new facility, so I was going to budget that in mind if I had.
Okay, that's fine. I'm glad that's happening, but I was trying to figure out.
We have struggled looking at different properties, and it's hard to find an area big enough for what we need to utilize with parking and a maintenance facility and enough room to house the drivers and training area that we need. So it's been a challenge, especially in the central area.
So Kenny, can I ask you about, you spoke about live cameras on the buses.
Yes, ma'am.
So who would have access or ability to see that video?
It would be internal, it would be whoever we deemed necessary. So if I had, a situation or a principal called me or an area coordinator called me or a parent called me, I could view this. So it's not like anyone would have access. So it'd be whoever we specifically, wanted to have access to. So we can assign access to that.
It seems like such a great safety measure. I'm a little surprised it's waiting until year 5.
Okay?
Is that something we might?
I could try to bump that up if we talk. Yeah.
And I just want to comment that a lot of the things you're doing are really technology related. So I'm a little disappointed or frustrated that we didn't see that in the technology work study plan that we saw at the last meeting. I mean, it's really technology, and this is student-directed technology,
Sure.
which to me is more important than administrative technology.
And technology's been very involved. I mean, Doug and we've met and done quite a bit together and researched and piloted and so.
I don't want to speak for the board, but I think that one of the top things is that GPS. That's what I hear a lot from our.
GPS and the parent app. The parent app is going to be really cool because they can specialize, they can put zones in. So if they want to know if they live down the street from Sunset Hills Police Department, they can plug in a zone for that. So they know when the bus is going to be there within a certain amount of time. They can put a zone over their home so they know when the bus was there. They can put a zone over the school so they know when the bus was at the school. And they can follow that bus throughout the entire route. So it'll be a neat concept.
That allows us to know if kids are changing addresses or moving to the district, and to include that as well.
That's a whole nother process, but I'm hoping to get there someday too, so, yeah.
Will it allow us to say when each child gets off the bus?
If that's what you want, you can put your zone over the house, yes.
Okay.
So you'll be notified there.
But you wouldn't necessarily know if your child was on the bus, if they were getting off the bus at a specific time. Student tracking.
Correct. So student tracking is a little challenging for us, because it's RFID or it is, visual,
Yeah.
or thumbprint, so it's a little more challenging for our students. We've piloted a couple systems like that, and they just have not worked. So what we've looked at is if we can just zone, and it's pretty accurate. I mean, if it stops at my house, it'll tell you how long it stopped at the house and where it is on the route at all times. So.
But that is something we're looking at as well. We're just not there with the technology part of it yet.
Yeah.
We will eventually be able to student track on the buses.
Yes.
That's what we're hoping. We're just trying to find an efficient.
It's a separate program, but we're working on that as well.
I bring that up because, was it 3-4 years ago, we were sued because at Hazelwood, I believe it was, when the student was placed on the wrong bus, our quote was on, quote, wrong bus, almost severely beaten.
Yeah, it happened to my son. I mean, he was put on the wrong bus, went home and nobody was home and ran barefoot back to school a year ago. So that's why I'm asking.
The other neat program that we can push messages out to parents through this app. We can communicate with each other through the app. So it kind of saves on the number of phone calls that are coming in. You can send me a message, I can send you a message. If we have an instance where there's a road closure, I can push the message out to that grouping of parents that said, hey, we're going to run about 20 minutes late because of a road closure. If we've got inclement weather, if we have reminders of school closings that, whether if you have multiple kids in multiple districts, you might not remember your child's calendar. We get a lot of phone calls wanting to know where buses are on days of work closed, so we can push all that kind of notification out through that system, so that it'll work great.
Sorry, but I have to circle back, Kenny.
Okay.
So what is the deadline on everything?
The deadline is as soon as I can get it done. We're in process now of working all this stuff together. We're in contact with our routing software. They're implementing new programs. We have a program designer that we've hired to do the student tracking and mileage mechanism. So we've got all that in plate right now, hoping that we can have all that implemented by the end of this year and rolled out for the beginning of next year.
I was talking about when students come into the district to change addresses. What is the timing on that one?
I don't know. I've been working on that for several years, so that's another process that I'll get with Doug and his team and Marcus Shane and see what we can help develop. Because that's been one of our biggest downfalls for a number of years is getting that accurate data of addresses and school changes and.
What's the biggest obstacle on that?
Biggest obstacle is just finding products that communicate. So getting our student tracking mechanism and then working with 22 school districts, to get that communication. How do we get their communication, their data into our data system? So that's one of our biggest problems that we have. So we need to be able to figure out how to get access to an IEP chair that can put information directly into like our routing software so that we have current accurate data. And we just haven't figured out a mechanism that'll work. So I'm hoping that we can get that.
So prioritizing the GPS and the student tracker and then
Yeah.
sure we have the
Yep.
system with the information.
Yeah, and that's been one of my big targets for many years, and we just haven't been able to accomplish that. But my understanding, we've got some things in the works, and so I'll get with the technology team and see what we can do to push that along. Dr. Keen's support, I think we can make that happen fairly quickly, because a lot of it's just job changes and additional job duties for folks, and probably implement that fairly quickly.
One last question. Do electric cars exist, do electric school buses exist? And can we start going that route?
The challenge with going electric is they only go so far. Our routes are long. We're a countywide program. I mean, so maybe some of our smaller. Some of our routes have 2 and 3 tiers. So, and until they get a bus where a charge will last longer, and then the payout, you're looking at that bus as a 20-year because they're so expensive, and the battery replacements are even much higher. So there are some grants and things like that out there available, but the payoff is just long-term. And with the students we transport, I like to keep that newer fleet, quality fleet, and just keep it maintained and keep that rotation cycle going so that we can ensure that we have the safest buses out there. So if we're having to stretch it out to a 20-year rotation schedule, we still have a bus that probably runs, but it's probably the maintenance costs are going to be very high. Yeah. Anything else? Thank you for your time.
Mr. Last presentation? So Dr. Hogg will give us a presentation on the focus areas for the budget. This is not intended to give us the final budget recommendations. We'll be doing that over the next several weeks. But just to kind of give the board our overview of the approach we've been taking in building out the budget and
Thank you. Good evening, President Cuneo, Vice President Brown, Board of Education, and Dr. Keenan. My name is Jeff Hogg, and I'm the Chief Operating Officer. The presentation this evening is to highlight the process used to build the FY22 budget. This presentation will focus on the process and some of the ideas we looked at, some of the data we reviewed, and as Dr. Keenan just said, I will bring more specific numbers, revenues, and expenditures over the next month. So the budget was created around 4 goals, and the first goal is that SSD will continue to provide necessary staffing and supports for students in our schools and partner districts to be successful. And when I talk about this, I'm talking about we began identifying needs and reviewing caseloads and student-teacher ratios to see where some discrepancies lie in teacher ratios. The second goal, SSD will continue to identify and provide curricular supplies and training for our teachers to provide best practice strategies. That allows our students to continue to be successful in the atmosphere they're in. And in an effort to streamline and create these efficiencies, we've started looking at centralized purchasing. We've done that to have more buying power, to make sure that we're buying the same things from school to school. And we've started that with our technology program and our curriculum department. And that's something that as we go through this first budget cycle, we'll really have a good idea on what we can do with that and where we can move forward. Goal number 3, facility and buildings. Goal number 3 is to continue to provide safe, secure, and educationally inviting buildings. The work towards this goal was evident as we presented the 5-year plan for facilities a month ago. And then goal 4. Goal 4 is based around equity and using equity as a lens to approach the budgeting process. This is incredibly important work, and it'll be explained in much greater detail in the next several slides. So just a reminder, we approached SSD, used zero-based budgeting as a concept to build this budget. Schools, districts, departments all started by identifying what they needed to provide the basic supports, the basic education. They identified wants, and those wants were what would allow them to continue to provide the robust education and instruction or support that they currently are. And then we had everybody look at enhancements to the curriculum, to learning, to their departments, to see how they could improve on what we're doing right now. And so, with this focus on equity, the Board of Education is currently working on a strategic plan for the district. One of those core values that emerged is the core value of equity. And as it says on the screen, every student, regardless of learning ability or socioeconomic status, deserves access to the services they need to succeed. And this is really what we started looking at as we move forward with putting together expenditures and requests for the budget. Special School District did an internal study in which we developed a framework to support all districts across the county. But to do that, we looked and we reviewed caseloads and minutes. We reviewed rates of identification, rates of least restrictive environment, and rates of proficiency. We looked and we decided the understanding the inequities in schools with historically underrepresented, underserved, and marginalized groups, and we looked at high rates of poverty. So in the internal study of the county and the partner districts, again, we looked at mobility rates, we looked at poverty rates, and we looked at percent of English language learners. So as you can see on the screen, we have variance in mobility rates from 8.6 to 43.5%, just in the county alone. Poverty rates vary greatly, from 9% free and lunch in some districts to 100% free and reduced lunch. Bayless, Rittner, as we look at English language learners, have the highest percent, and we wanted to make sure we took that into consideration as we built this budget as well. This is a heat map that shows the average distress community index. Some factors that play into this map in different shaded areas, mobility rates, free and reduced population, and other factors that negatively impact our students' education. And so by using this data, you can see the different at-risk levels, the different distress levels, whether it's prosperous, comfortable, at-risk, or distressed. And we use this to help build tiers so that we can go and even do more work towards this equity. And so that's where we decided to focus on all, and that'd be all districts. Some, which are some districts identified by disproportionality, and a few districts which really were drawn to our attention by that heat map. And so as we look, we move into 3 tiers. Tier 1 is all schools. And in Tier 1, we'll continue to ensure all schools and partner districts will continue to have staffing, supports, and curriculums that they currently have so that they can remain successful. As we look at Tier 2, we look at some schools and some programs. Tier 2 provides a greater support for districts identified as disproportionate. For these schools, we'll focus on providing support for social and emotional learning and interventions for literacy and numeracy. And then in Tier 3, the few schools, we've developed a framework to help with inequities in schools with historically underrepresented, underserved populations. We'll continue to review mobility, trauma, rate of special education identification, proficiency levels in reading and math, and poverty levels. And we'll work with the districts to decide what programs and what support they need to be successful. And so as we conclude the tiers and we conclude kind of the process of how we went about looking at expenditures and looking about staffing and support, we'll now move into some major budget assumptions. And again, these will continue to change as we go forward over the next month, but I kind of want to give you an idea of where we're at. This is a reassessment year. 2021-2022 is a reassessment year. Historically, we see about 8% increase in assessed valuation. Here recently, 2% in personal property. We don't gain all of that in our assessed valuation, so we have to use the CPI, which is inflation. So we're going to look at about a 1.4% increase in that, which equates to anywhere between $4.4 million and $6 million. So So right now, that's kind of what we're looking as an increase in revenue for next year, but again, that will change. Basic formula, Prop C, Classroom Trust Fund. Classroom Trust Fund's a little low right now. Prop C is right on track, and basic formula, we know for this year they had the withholdings. Right now, there is no indication that they wouldn't be funded at current levels for next year. But again, we'll receive some more guidance from DESE as the spring continues and as they know more. Investment earnings, we will see a decrease in investment earnings, but we saw a decrease in investment earnings this year. There's just no interest out there. There are no basis points for us to see a return on our investment. And then, again, we'll see a disproportionality will remain at approximately up to $5.5 million that we need to support our partner districts with. And then again, our curriculum budget will increase as we find more and more areas and identify that are good for us to make purchases for our partner schools. And so the next slide here, this is revenue by source. And as you can see, we've made some predictions, but again, I don't want you to focus on the predictions right now. I just kind of want you to see the slide, because when we talk about final predictions and final projections, you'll see this, and this will be where the main part of our budget is. So you'll see we'll talk about actual 19, actual 20, what was forecast for this year, and then what's budgeted for next year. We'll talk about change, and we'll move on from there. So as you can see right now, we're showing about a $4 million increase to the revenue, which we talked about. But again, I will bring much more detail, much more aligned numbers as we go in February. And so on the next slide with expenditures by category, again, you need to keep in mind as we look at budget, there are 5 areas for expenditures. There's salaries, there's benefits, purchase services, supplies, and then capital outlay. Again, you'll see this slide in much greater detail as we move into the budget process, but I just want to make sure you're familiar with it as we go. And so we'll see expenditures increase as we look at salary increase, benefit increase, so that's your insurance, a little bit of supplies, but we'll dial this in for you for next month. And so, next slide, thank you. As you can see over time, expenditures continue to increase. The next slides will show a little bit into the inside of why that they continue to increase, that they continue to go up. So if you look at the middle portion here, the middle column, you'll see SSD IEP students continues to grow. So back in 2015-16, there were 22,084 students. This past year, 2019-2020, there were 22,612. So we're seeing an increase in IEP students as we go. State of Missouri is seeing an increase in IEP students as well. This is an interesting slide because as you'll see in the top graph, countywide enrollment is decreasing. The count in 2016 was 137,500, and in 2020 it was decreased to about 135,500. So we're seeing a decrease in countywide enrollment, but if you look at the bottom graph, we see an increase that I just kind of talked about in the enrollment of special school district students. And then as we look at IEP minute trends, you'll see an increase in special education setting minutes. You'll see an increase in general education setting minutes, and you'll see a total increase. So students are becoming more enrolled in special education, and we're seeing an increase in minutes as well. And then this next slide is ABA minutes, or Applied Behavior Analyst, and you'll see that there is an increase not only in minutes a week, but students receiving those services. So that just kind of gives you some idea of why we see cost increase as we go, because we are seeing an increase in students identified for special education services. And then as we move on, we'll bring in much greater detail some position requests, but we will be asking for some positions. We'll be looking at asking for some teachers, some paraprofessionals, social workers, related service staff, support staff, grounds, and technology. And then we're also right now reviewing any areas that we could possibly cut, reduce staff, and that would be in just those same areas, teachers, paraprofessionals, social workers, and related services. But again, as we progress over the next month, we'll bring you much greater detail of numbers and what that looks like for the budget. I just wanted to make sure that you guys knew the process we use to get to how we're going to move forward from here. That concludes my presentation. I'd be more than happy to answer any questions.
I have one. Okay, real quick, I'm sorry, what mobility is that moving from home to home? What does that mean?
It's as students move in and out of the district.
Okay. This isn't really a question. Are we thinking that it's because kids are getting better diagnoses? That's why there's more services? Or?
That I do not know. I don't have a succinct answer for you on that.
It's a good question. And I always think that when you look at it's interesting to see the overall enrollment go down, but special ed is going up. So there could be factors of people moving in, but there's an internal identification that's happening in each one of our partner districts. And some of them have higher rates that are identifying more students than other districts. So it's kind of this ebb and flow. And that's why we had to look at some of those districts, because when we see those districts that have a little bit more of those distress indicators, they have higher rates, and therefore, how can we help support them with interventions and MTSS so that we want to make sure that we're an added value to make sure if a child needs special ed services, we're here to provide it. But it doesn't mean that every child has to receive, in order to get social worker services, the only way they can get that is if they have an IEP. So thinking about how we can support and benefit them to provide interventions to help see, does a child need to be referred to special ed, or can we help support an internal piece within those districts? That's really why we wanted to approach the budgeting this way, to support not only the kids that are coming in, but the students that are, that identification.
Thank you. Jeff, you mentioned trying to get some efficiencies in purchasing. I'm just wondering if we've used Ed Plus into that, because that's one of their big benefits that they provide.
I have talked to Steve Griggs there a little bit about that, but really right now we wanted to keep it internal and identify areas that we knew that our partner districts were purchasing, that we knew our schools were purchasing, but they were purchasing out of their own budgets. And so we looked at pulling those back in, gaining some purchasing power by purchasing from one contract as opposed to having 10 or 12. But yes, I agree, that is something that I have talked to Steve Griggs about, but really right now we're looking at how we can be efficient here first and then move out into that realm.
And I think the important part of that message is, what if I don't know I need it? And what if I know that, so like for instance, if you are in a district and you know that you guys have been purchasing certain curriculum or certain technology or certain supports for the special ed students, but yet I'm in a district and I don't know that I can do that. And this way, by mapping this out and correlating what we're doing with technology and with curriculum, we're able to say in every one of our districts, we want to make sure that if you're not purchasing this, do you need to? So that people are not, so that the goal is to say, when we look at equitable services across the county, we don't want to make it like if you don't know you need it or if you don't have it, how can we map that out with you to help support that? Because we want to make sure that it's not like, because I know I can order it, I get it, and if I don't know, I don't get it. So that's kind of our approach around it. But I have agreed with, I think we were going to just overlay it first that way and then see where can we get more purchasing power, and Ed Plus does offer some of those pieces. Ed Plus has also helped us a lot with the distribution of the masks, ordering masks, and doing those pieces, so they're very helpful. Yeah.
Should I approach though, Jeff?
I have a couple of questions too. Forgive me, these are silly questions, but on slide 18, on expenditures by category, there's looks like a change increase in total salaries of 2.1% for the budget for FY22. Is that the salary increase included in that, or is that a higher number of staff, or?
So right now, just for some preliminary numbers, we did increase that, whatever that percent is, the salaries, just to see where that would get us. Again, that's preliminary. As we start to move forward, we'll have a better idea. We'll talk to the budget committee next week get some guidance from them on how to move forward. But just for general purposes, we did put in that increase for right now.
And then, on the last two slides about position requests and reductions, we'll be getting firm numbers on these, and where the positions are, and that kind of thing.
Yes, and yeah, we're already with a spreadsheet going with explanations and everything else. So as we move forward, we finalize those, we will bring that to you in that regard of who, why, and where.
Any other questions?
Yeah, I think this is, again, something that's fairly obvious, but, looking at our expenditures for 2019 and 2020, we were under budget. Obviously, we're over budget for 21 and presumably for 22, so I hope that's going to be addressed very explicitly for those of us not on the budget subcommittee.
Yes.
The plan is to not keep that up.
Yes, as we bring that presentation forward, we'll explain that very clearly.
I think.
You want to be on the budget subcommittee? You can. There's room.
You gotta pick which subcommittee you want to be.
Oh, policy, I'll do that first.
I think she wants you on policy, right? She's like, I can't do both.
All right, thank you.
Thank you.
And thank you for our presentations today. Okay, would someone like to make a motion to approve the consensual items?
So moved. Second.
All in favor?
Aye.
All opposed? Motion carries. All right. 8.01, SSD school calendar 21-22. I believe.
The
Court calendar. Nancy, I believe you had a question on this one? Wait, do you have a motion to approve?
I move to approve the calendar, please.
Is there a second on that?
Second.
Nancy, I think you had a
Yeah,
question on that.
this is just a clarification question. But when I was looking at these, it looks like there are breaks after every quarter on here. And so I'm wondering for clarification if we could include that, the gray areas that are on here right now as breaks, in the key. I think it's included already for January and December for winter break, but there are other grayed areas in here that they don't necessarily say they're breaks.
Yes, ma'am.
It's a post document.
Yes, ma'am.
Thank you.
I told Wendy she could choose any color she wanted.
I think we need to plan
Exactly.
All right. Any other questions? All in favor?
Aye.
All opposed? Motion carries. 8.02, part-time hourly administration rates. Someone like to make a motion to approve.
So,
All right. Jan, you had a question on this one.
Yes, Amy, I know we've had other rate increases for other areas based upon COVID. Is this the same situation here?
It's not necessarily solely due to COVID. We have a very difficult time finding qualified, willing administrative substitutes. And a lot of it has to do with the training and specialization in special education administration, of course, but then also our lower pay rates don't assist with that. Most of our administrative substitutes are retirees, and they're limited by the state in the number of hours that they can work. And so if they can get a better rate elsewhere, oftentimes that's their first choice. So this would give us the opportunity to increase our rates to be able to fill those positions. We've really struggled this year filling administrative sub positions, more so than last year, which I think is partly due to COVID, but not the sole reason, like it was with the substitute rates that I brought a month or so ago.
Could you tell me what the previous rates were?
Yes, we had two set rates, $35 an hour and $50 an hour. And so the new proposed rates would be for level 1, would be $60 an hour, and those would be subbing for directors and principals.
I'm sorry, and what did that used to be? Okay.
And then we used to have $35 an hour for all other administrative subs, and bringing that to 40 and 50 with that level 2 and 3, with our level 2 being subs for our assistant principals and our area coordinators,
and then level 3 subs encompassing like our manager level positions and our non-instructional coordinators.
How does this compare to other districts?
This puts us much more in line with what other districts are paying for administrative rates.
Tell me how many employees are in each of these levels right now, or in the 2 levels that you have currently?
I could get that information, but I don't have it.
Thank you.
Any more questions? Comments? All right. All in favor?
Aye.
All opposed? Motion carries. Would someone like to make a motion for a closed meeting of the Board of Education on February 9th at 5:30 and on February 23rd at 5:30?
So moved.
Second.
On this one.
Director Adams?
Yes.
Director Faulkner?
Yes.
Director Goodman?
Yes.
Director Ide? Yes. Director Petrov?
Yes.
Vice President Brown? And President Cuneo?
Yes. Would someone like to make a motion to approve of our past minute meetings?
Second.
All in favor?
Aye.
All opposed?
I'm going to abstain from the 2
Yes,
executive
ma'am.
meetings.
Thank you, Nancy, that's very appropriate. Thank you. Executive meeting action. The following items were approved in tonight's executive meeting: employments, resignations, retirements, salary adjustment, extra duty pay, unpaid leave of absence, termination of employment, and 4 settlements. Calendar of events. Anyone, I would recommend that everyone read. Before we adjourn, is anyone here like to make a statement, any board communications would like to share?
I just thank the communications department for these lovely gifts. Very nice, thank you.
Yes, if you could thank the students for us, please. Someone like to make a motion to adjourn? Is there a second?
Second.
All in favor?
Aye.
All opposed? Thank you. I don't think I've ever been in a meeting where somebody opposed.